is Gynecologic Cancer Awareness Month, and Dr. Rodney Rakhani is here from Infirmary Cancer Care to talk more about this type of cancer and who is at risk. Thank you for stopping by.
Yeah, no, thanks for having me.
So we are talking about screening, and we all know early detection is key.
Absolutely. For any cancer, particularly GYN malignancies, early detection leads to better outcomes. And so, you know, for certain cancers like cervical cancer, getting screening pap smears on a timely basis is so important. But then also patients being aware of their own symptoms as well can help too. So
who needs to be screened? I mean, obviously women.
Women need to be screened, and I will say that it's a risk stratification. So patients, obviously, just patients at higher risk for cancers, whether it's a genetic predisposition or you know, age is somewhat of a risk factor as well. Then obviously they need to be screened more frequently than those that are low risk.
And I know that the age limit has changed for colonoscopy screenings. Has it changed in terms of the age for this as well?
It really has not, at least for the cancers that we take care of. You know, cervical cancer is the most effective screening test, you know, for cancers, and that should start, you know, in the 20s for most women, and really kind of continue on through a patient's lifespan, even beyond menopause. Should still have screening for cervical cancer.
And we were talking about beach symptoms.
That's correct.
What does that stand for? Yeah,
so beach is, you know, essentially we should all be familiar with it because we live near the beach, but one is bloating, so a patient feels bloated. Two is early satiety, getting full quickly. You know, abdominal pain, changes in bowel or bladder habits, as well as heightened fatigue. And so if you ask any postmenopausal women if they've had those symptoms, they probably would say, you know, check, 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 and check. But I think what's important about those symptoms is that just because of a certain age, if you haven't had those symptoms prior to that point in time, regardless of how old someone is, and it's new symptoms, that's important. And then also if it's persistent symptoms, it happens more than 15 days in a month, then that is something that you definitely need to seek out your healthcare provider to address.
And it's another reason why we really need to pay attention as to what's going on in our body and not just saying, oh, it's not a big deal.
Absolutely.
I want to talk to you about the importance of clinical trials. Very significant.
Yeah, clinical trials is something near and dear to my heart, and I believe clinical trials is the standard of care for cancer care. But without question, every benefit, every time we move the needle forward in a patient's care, it's all on the shoulders of clinical trials before. And so it's so important for patients to be involved in clinical trials, because if we don't study it, we don't develop the newer and better, you know, treatments for patients.
And there are always clinical trials going
There's always clinical trials available, and whether it's here in our region or referrals to other regions for other trials that a patient might be a candidate for. But one of my main goals and tasks is make sure that we have a trial for every single patient we see, and if we don't, then we need to create one.
Dr. Rakhani, it's always a pleasure having you here.
Thanks for having me back. I appreciate it.
Thank you. And we'll be sure to get this interview posted for you on our website and our YouTube channel so you can watch it and share the vital information with someone you know. Thank you again, Doctor.
Yeah, thank you.